A scientist knew her hormones were off, but doctors shut her down. Welcome to part 2 of our Medical Gaslighting in Women's Health series. I'm Dr. Bryan, founder of Health Without Risk and a retired gynecologist. I spent 35 years balancing women's hormones, starting in 1990 as an academic physician in the Division of Reproductive Endocrinology and Infertility. Today, we're diving into a harrowing story of a woman whose expertise was ignored by her doctors, exposing a systemic issue in women's health care. Picture this: a medical research scientist in her late 40s, brilliant and proactive, struggling with irregular periods, mood swings, fatigue, hair loss, skin and nail changes, and more. She suspected she had PCOS with overlying perimenopausal symptoms, both conditions that disrupt hormones. She went to 2 endocrinologists expecting answers, and instead they dismissed her. They refused to test her hormones, saying, "That's a waste of money, you're still menstruating." And I'll bet a bunch of you have heard that one. They only offered a TSH test for her thyroid, not enough to understand her health. Worst of all, they criticized the progesterone prescribed by another doctor, claiming it was too much and useless, despite not testing it and no evidence to the contrary. This wasn't just any patient. She's a medical research scientist, so she fought back. She quoted studies about progesterone for balance in perimenopause, for symptoms like anxiety, hot flashes, insomnia, etc., and explained that the TSH-only test misses critical thyroid issues, especially since PCOS and perimenopause can alter thyroid function. But the endocrinologist didn't budge. She hit a brick wall, leaving her frustrated and invalidated despite her expertise. This is medical gaslighting, when doctors dismiss your symptoms, making you question your sanity and reality. Perimenopause can start as early as your mid-30s, even if you're still menstruating. Hormonal fluctuations can cause mood swings, fatigue, and more. Yet doctors often say it's not your hormones or you're too young. Studies show only 31% of OB/GYN residencies even teach menopause or perimenopause care, and many providers rely on outdated tests like TSH alone. For PCOS and perimenopause, comprehensive hormone and thyroid panels are critical, but too often women are told it's all in your head. So imagine the toll: a scientist trained to trust evidence feeling dismissed. She's not alone. 2 million U.S. women enter perimenopause each year, many facing years of gaslighting before a diagnosis. This erodes trust, fuels self-doubt, and delays treatment, and worsens symptoms like anxiety, depression, night sweats, hot flashes, skin changes, hair loss. Systemic biases and poor training mean even specialists like these endocrinologists miss the mark. Don't accept gaslighting from a healthcare professional. Track your symptoms, use a journal or an app. Seek a menopause specialist. Some are certified by the North American Menopause Society, or functional medicine doctor. Demand comprehensive tests like full thyroid panels and hormone levels, even if they fluctuate. If your doctor won't listen, get a second opinion or contact me. Hormone replacement therapy like progesterone can be life-changing when prescribed correctly, as I've seen in 35 years of practice. This scientist's story is just the start. Follow Health Without Risk for part 3 of our medical gaslighting series, and stay tuned for a new series on perimenopausal gaslighting, which we launched today. Share your story in the comments. We're building a community to fight back. Subscribe and visit healthwithoutrisk.com, where we explore options for better health you won't hear from mainstream medicine. I'm Dr. Bryan, and I'm here to help you take control of your health. Let's end medical gaslighting once and for all. Until next time, have a great day. Bye.